Viagra uses, mechanism of action and considerations. Hi. Viagra, also known by its generic name Sildenafil, is a widely recognized medication primarily used to treat erectile dysfunction in men. Since its introduction in the late 1990s, Viagra has revolutionized the treatment of erectile dysfunction, providing millions of men with a safe and effective option to improve their sexual health and quality of life. What is Viagra? Viagra belongs to a class of medications known as phosphodiesterase type 5, PDE5, inhibitors. It works by selectively inhibiting the enzyme PDE5, which is responsible for breaking down cyclic guanosine monophosphate, CGMP, a molecule involved in smooth muscle relaxation and vasodilation. Mechanism of action. When a man is sexually stimulated, nitric oxide is released in the erectile tissue of the penis. This nitric oxide activates the enzyme guanylate cyclase, leading to an increase in CGMP levels. Elevated CGMP levels relax the smooth muscles of the penile arteries, allowing increased blood flow into the penis and resulting in an erection. PDE5 normally degrades CGMP, thereby regulating the duration and intensity of the erection. By inhibiting PDE5, Viagra prolongs the action of CGMP, enhancing its vasodilatory effects and promoting sustained penile erection during sexual stimulation. Uses. The primary indication for Viagra is the treatment of erectile dysfunction, a condition characterized by the inability to achieve or maintain an erection sufficient for satisfactory sexual performance. Viagra has been shown to be effective in a wide range of men with erectile dysfunction, regardless of the underlying cause, including psychological, physiological, or lifestyle factors. In addition to its role in treating erectile dysfunction, Viagra is also used off-label for other medical conditions, such as pulmonary arterial hypertension, PAH. In this context, Viagra helps dilate pulmonary blood vessels, reducing pulmonary vascular resistance and improving exercise capacity in patients with PAH. Considerations and precautions. While Viagra is generally well tolerated and effective for most men with ED, there are several important considerations and precautions to keep in mind. 1. Consultation with healthcare provider. Before starting Viagra or any PDE5 inhibitor, individuals should consult with their healthcare provider, especially if they have underlying medical conditions or are taking medications that may interact with Viagra. 2. Potential side effects. Common side effects of Viagra include headache, flushing, indigestion, nasal congestion, and visual disturbances. These side effects are usually mild and transient, but individuals experiencing persistent or severe side effects should seek medical attention. 3. Drug interactions. Viagra should not be taken concomitantly with nitrates or nitric oxide donors, as this can lead to potentially dangerous hypotension. Additionally, caution should be exercised when combining Viagra with alpha blockers or other medications that lower blood pressure. 4. Cardiovascular health. Individuals with underlying cardiovascular disease, including unstable angina, recent myocardial infarction, or severe heart failure, should use Viagra with caution due to the potential cardiovascular risks associated with sexual activity. And 5. Priapism. Priapism, a prolonged and painful erection lasting more than 4 hours, is a rare but serious side effect of Viagra. Individuals experiencing priapism should seek immediate medical attention to prevent tissue damage and long-term erectile dysfunction. In summary, Viagra is a valuable medication for the treatment of erectile dysfunction, offering men a safe and effective option to improve their sexual health and well-being. However, it is essential to use Viagra responsibly, under the guidance of a healthcare provider, and to be aware of potential side effects and drug interactions to ensure optimal therapeutic outcomes and patient safety. Wish you good health and happiness. Goodbye and see you again.